Hey everyone, welcome back. Today we're talking about something really important, common symptoms of cancer in men. Now this isn't about scaring you, but knowing what to watch for could make a huge difference. Cancer can show up in a lot of different ways, and sometimes the early signs are easy to miss or brush off. That's why it's crucial to understand what your body might be telling you. So whether it's changes you've noticed in your body or symptoms that just don't seem right, stick around. We'll cover the key warning signs every man should know, because catching it early can save your life. All right, let's dive in. Some of the most common warning signs of cancer in men include unexplained weight loss, ongoing fatigue that just doesn't go away, and persistent fevers without any obvious cause. It's also important to pay attention to any new or unusual pain that lasts over time. Changes in your skin, like new moles or sores that don't heal, can be a signal too. Lumps or swellings should never be ignored, especially if you notice them in areas like the testicles or around your neck. These could be signs of something serious and need to be checked out by a healthcare professional. Also, keep an eye on any changes in your bathroom habits. This includes things like needing to urinate more often, struggling to empty your bladder, or seeing blood in your urine or stool. These symptoms might feel uncomfortable to talk about, but they are important clues that shouldn't be overlooked. If you experience any of these symptoms, it's a good idea to get evaluated. Early detection can make all the difference. Elaboration. Unexplained weight loss. If you're losing weight without making any changes to your diet or exercise routine, it's something to pay attention to. When your body sheds a significant amount of weight for no clear reason, it could be a warning sign of cancer. This happens because some cancers can affect your metabolism or cause your body to use up energy differently. If you notice you're dropping pounds unexpectedly, especially if it's more than just a few pounds, it's important to check in with your doctor to find out what's going on. Persistent fatigue. Feeling constantly tired or drained, even after a good night's sleep or rest, can be more than just everyday exhaustion. Persistent fatigue that doesn't improve with rest is a common symptom that can sometimes be linked to cancer. This happens because cancer and the body's response to it can interfere with normal energy levels. Your body might be working overtime to fight the disease, or cancer could be affecting your blood cells, leading to anemia, which makes you feel weak and tired. If you find yourself feeling unusually exhausted for weeks on end, and it's not related to lifestyle or other obvious causes, it's important to get it checked out by a healthcare professional. Fever. Having a fever that won't go away, or one that keeps coming back, especially at night, can sometimes be a warning sign of cancer. While fevers are usually linked to infections, certain types of cancer can cause your immune system to react in ways that trigger a persistent or recurring fever. This happens because cancer cells can create inflammation or affect how your body regulates temperature. If you notice a fever that lasts for several days without an obvious cause, or one that wakes you up at night, it's important to talk to your doctor to figure out what's going on. Pain. Experiencing ongoing pain that doesn't have a clear cause can be another warning sign of cancer. While occasional aches are normal, persistent or worsening pain, whether it's in your bones, back, or any other part of the body, should not be ignored. Some cancers can press on nerves or organs, causing discomfort or pain. In other cases, pain might result from cancer spreading to bones or other tissues. If you have pain that lasts for weeks or months and doesn't improve with treatment or rest, be sure to get it checked out. Skin changes. Any new or unusual changes in your skin could be a sign to watch closely. This includes new moles, changes in the size, shape, or color of existing moles, sores that won't heal, or patches of skin that become red, irritated, or crusty. While many skin changes are harmless, some can be early signs of skin cancer or other health issues. For example, melanoma, a serious form of skin cancer, often shows up as an irregular mole or spot that looks different from others on your body. If you notice any skin changes that don't go away or seem to be getting worse, it's important to have them looked at by a healthcare professional. Lumps or swellings. Finding a new lump or swelling anywhere on your body can be concerning, and rightfully so. In men, lumps in areas like the testicles or neck should always be checked out by a doctor. While many lumps turn out to be harmless, some can be early signs of cancer. Cancerous lumps tend to be hard, don't move easily when you press them, and may grow over time. On the other hand, benign lumps like cysts are usually softer and can shift around under the skin. Regardless, it's important not to ignore any new lumps. Getting a professional evaluation is the best way to find out what's going on and get peace of mind. Changes in bowel or bladder habits. Pay close attention if you notice any changes in how often you're going to the bathroom, or if there's a difference in the way things look or feel. This could mean needing to urinate more frequently, struggling to start or stop urination, or noticing blood in your urine. Changes in bowel habits, like constipation, diarrhea, or blood in your stool, are also important to watch for. These symptoms might seem minor or embarrassing, but they can be red flags for cancers of the bladder, prostate, or colon. If you experience any of these changes for more than a few weeks, it's a good idea to get checked by a healthcare provider. Persistent cough or hoarseness. If you have a cough that just won't go away, or your voice has been hoarse for weeks, it's worth paying attention to. While these symptoms often come from common infections or allergies, when they stick around longer than expected, they could signal something more serious, like cancers of the lungs, throat, or voice box. Persistent hoarseness can also result from issues affecting the nerves that control your vocal cords. If your cough lasts more than a few weeks, or your voice sounds different without an obvious reason, make sure to see a doctor for a thorough checkup. Unexplained night sweats. Waking up drenched in sweat when the room isn't even warm can feel alarming. While night sweats can happen for many reasons, like infections or even menopause, if they happen frequently and without an obvious cause, they could be a sign of something more serious, including certain types of cancer. Some cancers cause the body to release chemicals that affect your temperature control, leading to these unexpected sweats. If you're regularly experiencing night sweats along with other symptoms like fever or weight loss, it's important to get checked out. Unexplained lump or thickening. Feeling a lump or an area of thickened tissue anywhere on your body can be an early warning sign of cancer. This might show up in places like your breast, testicles, or under your skin. Unlike harmless lumps that are usually soft and movable, cancer-related lumps often feel hard, fixed in place, and may grow over time. It's important not to wait or guess what it might be. If you notice any new lumps or thickening, have a healthcare provider examine it as soon as possible. Early evaluation can make a big difference. Persistent mouth sores or ulcers. If you have a sore or ulcer in your mouth or on your tongue that doesn't heal within 3 weeks, it's important to get it checked out. Most mouth sores heal quickly and are harmless, but a sore that lingers could be an early sign of oral cancer or other serious conditions. Pay attention if the sore is painful, bleeds easily, or looks different from usual. Early detection through a dental or medical exam can help catch problems before they become more serious. Unexplained bone pain. If you're experiencing persistent bone pain that doesn't seem linked to an injury or physical activity, it's something to take seriously. Certain cancers, especially blood-related ones like multiple myeloma, can cause bone pain by affecting the bone marrow or causing damage to the bones themselves. This pain is often deep, persistent, and may worsen over time. If you notice ongoing bone discomfort without a clear reason, be sure to discuss it with your healthcare provider for proper evaluation. Unusual bruising or bleeding. Notice bruises or bleeding that happen without any obvious injury? This could be a sign that something is off with your blood or immune system. Some cancers can affect your body's ability to clot properly, leading to frequent or unexplained bruises, bleeding gums, or nosebleeds. If you're experiencing these symptoms regularly or without clear cause, it's important to get evaluated by a healthcare professional to rule out serious conditions. Unexplained swelling or lumps in the neck or groin. Swollen lymph nodes or lumps in areas like your neck, underarms, or groin can sometimes be a sign that your body is fighting an infection, but they can also indicate cancer. These lumps may feel firm, painless, and persist for weeks or longer. If you notice swelling or lumps that don't go away, get bigger, or are accompanied by other symptoms like fever or night sweats, it's important to have a doctor check them out. Early diagnosis can lead to better treatment outcomes. Persistent coughing up blood. Coughing up blood, even just a small amount, is never something to ignore. It can be a warning sign of serious conditions such as lung cancer, infections like tuberculosis, or other respiratory issues. Sometimes the blood might look bright red or mixed with mucus. If you experience this symptom, especially if it persists or is accompanied by chest pain or shortness of breath, see a healthcare provider immediately for a thorough evaluation. Difficulty swallowing, dysphagia. If you find yourself struggling to swallow or feeling like food is getting stuck in your throat or chest, don't ignore it. Difficulty swallowing, medically known as dysphagia, can be a warning sign of cancers in the esophagus, throat, or even nearby areas like the neck. This symptom might start subtly, but can worsen over time, causing discomfort or pain when eating. If you notice persistent swallowing difficulties, make sure to get evaluated by a healthcare professional for proper diagnosis and care. It's important to remember that these symptoms can be linked to a variety of health issues, not just cancer. That said, catching any warning signs early is key to effective treatment. If you notice any of these symptoms, don't hesitate to see a doctor for a proper evaluation and care plan.